it's your girl KV
and Celine,
and we are back with another season of the Hood Health Report. So today we are going to talk about artificial intelligence advancements in the health industry. Two products in particular that really caught my eye because I saw them and I was like, these are some things where they make sense, but it's something that, you know, we would expect to see on like the Jetsons or something. You know what I mean? Something real futuristic. Like, I don't know if the culture will really adapt and accept these things. So let's just jump right on in.
Who said that? All right. So the first article that we read was Step into the Pod that uses AI to diagnose and treat in minutes. So KV, how would you feel about walking into like a futuristic pod and getting a full body scan, blood test, personalized health in minutes?
In minutes?
In minutes.
Just in like a little pod. So my first mind is like, wow, are y'all trying to ship me out to war? But being someone that like, I've had a child, so thinking about all of those appointments that go into the last month of pregnancy where they just checking vitals, I'll be like, ooh, this will be so much easier to just walk in here, check my blood pressure, check this, make sure it's good. I can go home in 10 minutes versus sitting in the office for an hour. So I'm really on the fence on whether I would actually adopt something like this.
Well, there's a company called Ford, and they plan to make this a reality. In 2023, it launched its first flagship product called the CarePod. It claims to be the world's first AI doctor's office. So, if you're wondering what an AI self-service healthcare pod is, CarePod is an AI-powered self-service pod that combines artificial intelligence with medical expertise. They offer advanced diagnosis and personalized health plans, and you can access like a variety of things through health apps, including like disease detection, biometric body scans, blood testing, and a lot more.
And it seemed like with some stuff like the biometric body scans, it could possibly be more accurate than the human eye because it could kind of get more into the cellular level of, oh, you've got this keloid or this growth. Is it just a skin tag or could it possibly be something more? So there are some parts about it that sound like it
might be like worth going to a CarePod instead of like going to a care office or something like that. So I know like another big thing that people probably are wondering about is like, how much would something like this cost? Like when I think about a CarePod or like AI, I automatically think like high price or like, you know, very expensive. Doctor's appointments in themselves are already expensive. So with this, they claim that the membership for Ford would start at like $99 per month. And that gives you access to their app. The platform gives you real-time monitoring, risk identification, in-depth health evaluations using like a range of sensors, lab tests, vital sign measurements. While the app is mostly AI-powered, the really cool thing to me was that they said they would have like 100 primary care clinicians to make sure that all the healthcare decisions were like being processed and stuff like that. So like, even though it's AI centered, you could still have like a doctor or somebody there to like go over certain things to make you feel a little bit more comfortable. What do you think about that?
It kind of felt like it defeated the purpose for a bit because they were setting these CarePods up in like malls, right? So it's like you could just set these up at the doctor's office if that's the case and like build out a bigger waiting room so that if it is some, you know, ooh, your blood pressure real high, go ahead, check on over for an appointment versus it being in a mall and then like where they like Zoom in a doctor or something, you know, like what exactly is that process for them to have doctors on hand for you, but you're in the middle of a mall?
True. So like bringing that part up, they did say like malls, gyms, offices, so it could like focus like on metropolitan areas. I think the biggest thing that they were concerned about is like with the membership, you necessarily don't need insurance. So like you could still get those quality things that you want to go to a doctor with, but now you're not having to pay like co-pays and other things like that for going to a doctor's office.
That was also interesting as well, where it's like, okay, well, we don't take insurance. You just take this, you know, service by fee service. And it's like, with that though, you're cutting out a large population of people because some people probably can't afford to pay $100 a month, and that's just the base cost. We don't know what might go into it or how many that might be. One appointment a month for you to go in. Some people might need more, depending on, if they have any type of chronic illnesses or things like that. And then also with that, if something is found and they don't, have insurance or, whatever that case might be, like how does that now go over to the doctor's office for those people?
So you're more so saying, like, let's say I go in, they tell me I have something that's going on. What if I need to go to like the emergency room, something like that? Like some unanswered questions that might occur if you go into this little CarePod. Okay, I see where you're coming from with that. The other thing that this article mentioned was like how it stacks up against other AI healthcare providers. So Ford is not the only company that is trying to like revolutionize healthcare with AI. Some other companies that are offering these things are like Babylon Health, Ada Health, K Health. They offer similar services such as online consultations, symptom checkers, and health trackers. But the biggest difference with Ford, it says that its mission is to make healthcare more accessible, affordable, and personalized. And like you mentioned, it did have some really good points, but not everybody is able to just pay a membership fee, or like they're maybe not able to like see a doctor unless they have like copay, or like some people their first option is the emergency room because like at least they know they're going to treat them regardless of whether or not they have the money that day or not. So that's like something that you have to do your own research and make sure it's something that you would want to do. Ford hopes to reach more people and improve the health outcomes by combining AI with the human expertise and cutting-edge technology. So like their thought process, I kind of get it. They're saying like they want to try to mix the two, but with healthcare it's kind of hard because I feel like being a healthcare like provider or something like that, you have to be like personalized. People don't just want to talk to a computer screen about their health. They're more so want like a real person there to be like able to explain certain things to them and like kind of go through that experience with them.
Right. And then is AI even advanced enough to really talk about symptoms? Because that's not like like a scripted type of conversation. People could say anything and will AI really register that and know how to reply back to be effective in this journey?
Right, because if you get on Google, you can type in "I got a headache" and it might tell you it's your last day. So you gotta be real careful with like what it is, because AI is still like learning. So as it's gathering the information, it's going to be changing. So that's something to be on the lookout about. I'm going to move into our next article. It's still about the AI doctor's office. And this one, the main thing that stuck out about it, it just talked more about like the different things that the AI CarePod might offer. So it says, new AI-powered doctor's office allows patients to draw blood and take vitals. And this article mentions a few things that I didn't cover in the first article. You have things such as being able to draw blood. Your DNA can be sequenced, tests for hypertension, kidney disease, and heart issues. Your doctor can review the doctor's stuff off-site, and it talks about like the doctor being virtual through the CarePod. The machine takes baseline readings for metabolic functions, so it can assess how you're doing over time. And you can choose like the Heart Health app, and it actually opens a tray and hands you like a sensor, so you can put the sensor up against yourself and like do some of the readings yourself. And I thought that was kind of cool, but like at the same time, me being me, I know I'm not a doctor, so I just would feel like, am I doing everything correctly? Right. And then it's like, okay, so if I get this reading back, how accurate is it because I'm doing it versus somebody that's been like in the field for a while doing their job? What do you think about that?
I think it could definitely be tricky with that, because if you gotta hold something and be still for 10 seconds, who says I have a steady hand to be still for 10 seconds? So it might just be, a waste of a virtual appointment if I can't even
do it properly. That's my thought process behind that. I'm just like, okay, it seems cool in theory, but like, what age group are you applying this stuff to? Because like older people, maybe they couldn't go into a doctor's office and be like so hip and able to like do some of these tests. So I mean, the crowd that they're saying they want to reach everybody, is it really accessible for everybody?
Right. That's what I said. If I were to execute this, it seemed like it should be like a pod in a waiting room or a section like the triage section of the hospital and stuff, and there's a nurse to assist with it, but it could still be AI. It could still be like, okay, we just dropped the blood right here. And tell us this. Okay, you stand right here and just do this, but I'm there to hold that little thing to get the x-ray or do this or whatever it is. But I feel like it's definitely something that would need tending to. Like, it shouldn't just be me walking in there, but that's the whole point of them making the pod and putting it out in the malls and the gyms so that it can just be easily accessible.
Right.
But yeah.
So continuing on with this AI CarePod, the next title is These Pods Bring AI Doctors to Every Street. So Adrian is the San Francisco-based founder for Ford. He formerly worked for Google, and he sold his first AI-related startup to the company in 2013. He spent time in the company's AI division before becoming a director for special projects for Google co-founder Larry Page. He uses a system that is straightforward. Users visit the CarePod and are tested, thereby giving the system a wide range of information about their heart, taking their readings, and explains those to the person. And I wanted to include this one because I wanted people to get like a little bit of background of like how the CarePod came about. So he was already in AI. He worked for Google. He's already had like startups and stuff like that. So I feel like his thought process when creating CarePod, it might be different than somebody that is a healthcare provider, because he's looking at it from like an AI standpoint. And I don't think I included this in the article, but when I was reading it, it just more so seemed like kind of like Elon, where it's like they have that brain for like, okay, AI, and they see like the problem is one way, instead of like looking at it from like a perspective of like maybe like a community health worker, where you're like looking at how people will be able to adapt to something or if they'll be able to use it. It's not a car. Like this is totally different. Like dealing with people and how their health is, I think it's just something where you have to have like maybe a background in health too.
Or and I'm not some type of doctor as a consultant.
Yeah, and it just seems like I get where you're coming from. You want it to be very straightforward, but that only works for certain things, and I don't think healthcare is necessarily something that you can do that with. At least not the way he was trying to do it. I think the doctors definitely need to be
on hand.
Yeah. Right there. Okay, this next article talks about the $100 million rollouts for CarePods as a self-service clinic. It's called Primary Care Players 4 unveils a AI-based self-serve CarePod backed by 100 million Series E round. So Ford picked up $100 million in Series E funding round to build and roll out the Ford CarePods. The startup raised more than $657 million to date, according to TechCrunch. It raised an additional $225 million Series D funding in 2021. Ford, however, has been relatively quiet since its 2021 Series D fundraising round. It is also worth noting that other companies are joining in on the healthcare industry, with CVS scooping up Oak Street Health for more than $10.6 billion. Amazon has bought One Medical for $3.9 billion, and Walgreens Village MD acquired Summit Health City MD for nearly $9 billion. With this, it's just like noteworthy to notice that a lot of these bigger companies that necessarily don't have anything to do with health are starting to like swoop in and get into this realm. And so it'll be interesting because, like we were just talking about, a lot of times their mindset isn't necessarily on health, it's like more technology based. So like I wonder if the quality of everything going into health will be as accurate, or like it'd just be interesting in the next couple of years to see what they're able to do with these companies that they're acquiring and going after, especially since they're putting so much into like gathering them.
So with all of this information about the CarePod, when I first saw like the little video that we showed, I was like, okay, well I wanna, now that TikTok is still here, let's see if somebody on TikTok has experienced one of these CarePods. I go to search and I can't find anything. I go to the website. It's no longer a thing, you guys, because Forward abruptly closed its doors, okay? Primary care player Forward shutters after raising $400 million, reports Fierce Healthcare. So they abruptly closed their doors, canceling all of the visits, even shutting down the app immediately. Mm-hmm. They claim that people will just have to do something like write in or call in to get their medical data that was housed on this app. So it's nearly 200 employees are now unemployed with seemingly no notice, because it doesn't really seem like this was, something that they were anticipating doing. Mm-hmm. So at the time of this article, it was published November 2024. Forward had been operating for 8 years with 19 locations and more than 100 primary care clinicians on hand. The 2016 health tech launch was on a cash pay model that did not take insurance, as we mentioned. TechCrunch reported that the company raised $657 million and reached $1 billion valuation in 2021. Mm-hmm. With the help of many investors, one of which kind of was like, it was The Weeknd. I was like, oh, okay. So The Weeknd was trying to be in this little CarePod, which put weird images in my head because he's a weird one. So that's what really made me be like, okay, that probably was the problem. But some industry observers and physicians feel that these CarePods were too techy and that people wanted that bedside manner. They wanted to be able to talk to a physician and really have someone interacting with them. But others feel like that the downfall was the expensive real estate, because they had to have these big spaces in New York and San Francisco, and it was just quite a bit of money to maintain. Mm-hmm. And with that, my first thoughts would be, okay, well, what about maintenance? How are these maintained? How often do they have a tech come out to make sure that everything's working correctly? How often are these things cleaned? Because
you got sick people possibly coming in and out of these, and nobody's coming in between visits.
That was the main thing for me. And then also, I thought about vandalism. Like, if this is just, up in the middle of a gym or in the middle of a mall, this might be something that everybody, doesn't really agree with. A lot of people don't really like technology in our medicine. So what if some crazy people was just going up, taking a bat to this thing every other day? Because, that is the America that we live in. So that was a lot of the concerns that I had when I was first reading about it, that I'm like, I wonder if any of these problems could have also led to the reason why they abruptly closed their doors. And then also looking at the date of when this article was, it was like a week after the election news. So I'm like,
interesting time.
Interesting time, and I'm wondering if that had a dealing in why it is no longer, but
we will never know, huh?
I guess we'll never know.
Yeah.
So Celine.
Yes.
Would you let AI rock you to sleep?
Girl, that don't sound like something. That don't sound like something I want. I don't know about that. You have to say some more words.
She said more details, please.
Yeah, let me hear about it first.
So this next product is a mattress cover by 8 Sleep. And me personally, I would absolutely let this AI rock me to sleep. So this is a mattress cover, and it's attached to what kind of looks like a humidifier. And that humidifier looking thing fills it with water, fills the mattress cover with water. So already I was sold, because I loved water beds growing up. I used to always want to play on some water beds. So I'm like, okay, it's giving a water bed feel. This might be real comfortable and nostalgic. And so they also, the bed can incline to elevate your head or your feet for maximum sleeping comfort. And some of its key features are dual cooling zones. So if I'm somebody that gets hot in the bed and my husband's somebody that gets cold, his side can be programmed to keep him warm at night, whereas my side can be programmed to keep me cool at night, which is something that we see in like other different mattress brands as well. But this one also has a layer of sensors that tracks your sleeping vitals. You don't have to wear, any type of fitness tracker or anything like that. Like, Apple Watches, Fitbits kind of track that too. But this little mattress cover takes all of that. It takes your time you spent sleeping, in each stage. So it'll let you know how long you were in REM sleep, how long you were light sleep, how long you were in your deep sleep. It also looks at heart and respiratory rates, looks at what time you went to sleep, what time you woke up, if you snored, if it was a restful night, or if you kind of stirred around a bit. And in addition, the mattress cover can be added to any type of bed, but if you want to get the entire base to have it where it elevates the head or the feet, they have that available as well, and it has snoring detectors. So if you start snoring throughout the night, it will lift up your head to allow for easier breathing. So I was like,
sold.
sold. Like, I might need to start saving my coins so I can get this little product, because this sounds great. It clinically proven to increase people's sleep time by an hour. So that was also like, okay, because
as a very sleepy girl, I feel like that would be great.
I know, same. And then I don't get a lot of sleep.
Yeah.
Well, I won't say I don't get a lot, but I'll get like 5 to 6 hours of sleep. So if I had something like this that can give me to that 6 or 7 hours of sleep, that would be a game changer. So what about now? Do you think you'd let AI rock you to sleep?
Yeah, I do actually. And as you were talking about it, kind of remind me of like those other like smart mattresses. I think I like the fact that this one is like just like the topper, so like you can adjust it to whatever kind of bed you already have. You not necessarily have to buy like a whole new system in order to like have all those accessibilities. So I think it's pretty cool. I don't know. I just be like a little bit on like the edge about like things tracking, like when I sleep, when I wake up, all that. Yeah, like where is that? Like I get it, because then I can see it myself. But I don't know. I'm trying to get there. I haven't got there completely yet, but I feel like some of the added benefits outweigh like those things that kind of, things I'm kind of like a little about.
For sure. And another feature on this mattress cover, they have a smart tap feature. So at your wake up time, the mattress cover can vibrate to wake you up gently and to let it know that you've woken up. You just kind of doop doop and tap the side to make it stop vibrating. Or you can program that smart tap button to heat the side of your bed, cool the bed, or to elevate you. So it was a really cool features there. So I know you're probably thinking, well, how much does this cost?
Yeah, tell me the price.
This is very, very, fancy tech here. So for just the mattress cover and the hub that I mentioned look like a little humidifier, that would be about $2,600. Not too bad. And then for the entire base with the base that elevates your legs or your head, that would be $4,600. So not too bad.
Yeah.
And it seems appropriate for the time. It's still accessible where if you wanted, you could possibly get.
Right.
Because I was expecting like, this is about to be $6,000 for the base model.
I was thinking like closer to $10K, which is good. So like, it's not like super. I wonder if they could put it on Klarna.
That Klarna, a firm,
something like that. But even if not, it's something that you could save up for, especially if you're someone that really values your sleep, or like that's something that you want to know about and like just get like a really good deep sleep. I feel like it would be worth getting into.
So what about you guys out there? Would you let AI rock you to sleep, or would you walk into a CarePod and let them act as your doctor? Let us know. Sound off in the comments, you guys. That's it?
Yeah, that's it. It's a new season.
Welcome.
So this is a wrap for this episode. I hope y'all enjoyed it. You can follow us on Instagram, which is Hood Health Report, as well as Facebook and Twitter, Hood Health Pod.
We also have a TikTok page now, Hood Health Report. Follow us there.
Yeah.
Don't forget to subscribe to the YouTube channel. All of the links will be in the descriptions and the bios for you to click on easily.
Tap, like, comment, do it all.
Subscribe, all of the things. Share it with a friend.
Yes.
Share it on your social media.
If you have a TikTok, make a little video, send it.
Let us know you're out there watching, guys. All right, that's it for this episode.